In addition to spreading misinformation and lies, Robert F. Kennedy Jr. is continuing to implement his anti-vaccine agenda and doing everything he can to limit the American public's access to vaccines. On Monday, June 9th, 2025, Kennedy fired all 17 members of the Centers for Disease Control and Prevention, or CDC, Advisory Committee for Immunization Practices, known as ACIP. Kennedy lied, claiming that the members had received funding from pharmaceutical companies. I'm Bambi, reporting and narrating for Crystal, STEM Now's anthropologist, STEM education researcher, and political activist. The members of the Advisory Committee for Immunization Practices have an extremely influential role in determining the vaccines that will be widely available to Americans. The committee members are carefully scrutinized to determine that they have the expertise to make vaccine recommendations and that they have no conflicts of interest related to vaccine manufacturers. The committee members review vaccine data, debate the evidence of effectiveness, and decide which Americans should get which vaccines and on what schedule. The Secretary of Health and Human Services can choose to reject or modify the committee's vaccine recommendations, but the Secretary usually accepts ACIP recommendations. By law, most private health insurance plans, employer-sponsored health plans, Medicaid, and Medicare are required to pay for vaccines recommended by the committee at no cost. The committee also establishes and revises vaccine recommendations for the Vaccines for Children program. The Vaccines for Children program is a federally funded initiative that provides vaccines to children whose parents or guardians cannot afford them. If the committee or CDC vaccine recommendations are narrowed or removed, health insurance companies would no longer be required to cover vaccines at no cost, and the Vaccines for Children program will no longer provide vaccines. Consequently, only affluent people with adequate financial resources would be able to access life-saving vaccines that contribute to effective public health strategies. Congress established the Advisory Committee for Immunization Practices in 1964 as an amendment to the Public Health Service Act. The amendment states that, quote, the ACIP shall provide advice and guidance to the director of the CDC regarding use of vaccines and related agents for effective control of vaccine-preventable diseases in the civilian population of the United States. The amendment also specifies that committee members shall be selected by the Secretary of Health and Human Services, and that the members, quote, shall be selected from authorities who are knowledgeable in the fields of immunization practices and public health, have expertise in the use of vaccines and other immunobiologic agents in clinical practice or preventive medicine, have expertise with clinical or laboratory vaccine research, or have expertise in assessment of vaccine efficacy and safety. The committee shall include a person or persons knowledgeable about consumer perspectives and/or social and community aspects of immunization programs, unquote. Kennedy has violated the Public Health Act by selecting 8 replacement committee members who have little vaccine expertise, are openly skeptical of vaccines, and have spread misinformation about vaccines. For example, Robert W. Malone promoted conspiracy theories and the false claim that ivermectin and hydroxychloroquine could be used to treat COVID-19. The committee, with its new unqualified members, met on June 25th and 26th. Several of their decisions were alarming and harmful to the health of children and adults. They announced that they would reevaluate vaccines that already have safe track records. They indicated that they would vote at the next ACIP meeting to stop allowing the use of a combination vaccine for measles, mumps, rubella, and chickenpox for children younger than 4 years of age. They also recommended that children and adults no longer receive flu vaccines containing trace amounts of the preservative thimerosal, although it is rarely used in vaccines. This decision is based on the scientifically debunked claim that thimerosal is linked to autism. The presentation on thimerosal was made by Lynn Redwood, a nurse and former president of Children's Health Defense, the anti-vaccine advocacy group that Kennedy founded and led for many years. They failed to vote on recommending a COVID-19 vaccine booster for the fall. We encourage you to contact your elected representatives, whether they are Democrats or Republicans. Share your concerns about Kennedy's anti-vaccine actions and ask them to pressure Kennedy to change course. Thank you for watching. Please subscribe to this channel, like, and comment on this video.